Artificial intelligence has been around for quite some time. For instance, in predictive text in your mobile phone, it's only been recently that we've seen an explosion in interest in the subject. And not just interest, but fear, as even tech influencers throw around apocalyptic predictions. Even Elon Musk warned recently that AI could lead to, quote, civilization destruction, end of quote. And lately, we're seeing fake photos and videos so skillfully rendered, it's hard to tell what's real anymore. Meanwhile, AI is changing our personal lives every day, from the ability to create instant AI art projects to medical applications that allow us quicker and more accurate diagnoses. It's clear that the advent of artificial intelligence for the masses is creating a future that we may not have anticipated and may not know how to handle. Fox 11 News In Depth starts right now. The use of artificial intelligence in medicine could be life-saving. Not to say that doctors don't do a good job right now. They do. But providing them with tools that make them more efficient could be a real game changer. Joining us right now is Dr. Suzie Bash with RadNet. Suzie and I have known each other for a long time. We've often talked about this issue of artificial intelligence in medicine. And you know, you've sort of become the neuroradiologist extraordinaire when it comes to AI. So where does artificial intelligence play a role in medicine right now?
Yeah, so AI is really revolutionizing medicine, and I would say probably most profoundly in technology-based subspecialties like radiology. So we use, I work for RadNet, which is the largest outpatient imaging enterprise in the U.S., and we use a lot of different AI tools. In fact, I've been using AI in my clinical practice for about 18 years now.
But when we think about radiology, we think about MRIs, we think about CAT scans. Now we're thinking about AI.
Right, and we're applying that throughout all levels of imaging, before the patient's image, during image acquisition, and after. And it's really exciting, some of the things that we're seeing. So
how does that work?
Yeah, so there's a lot of different AI tools that we use. But for one, for example, we can use AI to scan, that allows us to scan patients 50 to 75% faster when they come in for an MRI.
All right, so speed is one thing.
Speed is huge, because it turns out that, 30% of patients have a severe anxiety reaction when they go in the magnet.
Yeah,
and so
you get in that tube, you feel claustrophobic,
exactly.
Right?
And so to be able to get them in and out faster is very important. In fact, patients rank that as their #1 important element when they're ranking their imaging experience. But we don't just go faster. The AI allows the higher image quality as well. So radiologists love it. And truthfully, when we have very high image quality, that can improve our diagnostic capability. Yeah,
right, so to be clear, MRIs are better than CAT scans, right? Because you get layers and you can see things better. But what does AI do to add to that mix? And does it help the CAT scan look better as well?
We can use AI. In fact, we do use AI for CT. But in terms of speeding up the exam, CTs are already very fast, but MRs are slower. So again, to be able to get them in and out 50 to 75% faster, but with better image quality on MRI is a huge plus for everyone involved.
Mammograms are more accurate?
Well, mammograms in evaluation of breast cancer, we use AI for cancer detection as well. So that's not so much about a speed, because a mammogram is fast, but it's amazing, this technology. We use an AI tool at RadNet that allows, this AI tool will actually pick up breast cancers 1 to 2 years before expert breast radiologists. And obviously, the earlier you can diagnose the cancer, the more successful the treatment will be and the better the chance of survival. So AI is making a tremendous difference in the lives of patients when it comes to cancer recognition. We also have AI tools in development for detecting lung cancer and prostate cancer. And the reason why AI is so good for cancer detection is AI is actually better at pattern recognition than humans. It's also better at faster data processing. But humans, on the other hand, are better at global reasoning. So there's a very synergistic relationship between AI and physicians when it comes to interpreting these exams, but it's making a big difference.
Well, where do you see this stuff going? I mean, obviously, we've been talking through this show about, where it is and where it goes. You're talking about such an advanced situation now with AI. Where can it go?
Right. Well, I personally think that there will not be a single imaging study that's not first evaluated by a computer in the future. One of the big things that we're using AI for in the radiology industry is to detect urgent and critical findings on exams. So the AI is applied before the radiologist ever sees the MRI or CT, and it can detect things like brain bleeds or cervical spine fractures or pulmonary embolism, blood clot in the lungs, abdominal aortic aneurysms, and very importantly, strokes. Turns out that 1,400 hospitals in the United States are using AI when a patient presents to the ER with symptoms and signs of a stroke. And these patients are doing much better because the faster you can get them to treatment, the better their overall neurologic outcome is. In fact, 40% better. Their hospital stay is 2.5 days less, and the time from the minute they hit the ER to the time to treatment is decreased by 87 minutes when you use this AI technology. So it's very, very exciting technology.
Like I said before, I've known you for quite a long time. You sound like you're incredibly enthusiastic about this. I mean, enthusiastically enthusiastic.
I am, really. I am a big believer in AI, but that doesn't mean that there doesn't need to be clinical validation trials to make sure that these products, that the vendors of AI are actually delivering what they claim to.
And perhaps regulation as well.
Absolutely, yes. But, you know, like I said, we've been using it for a long time. For example, in the evaluation of patients with dementia and multiple sclerosis, it's making a big difference there as well. And so there are many different areas in medicine where AI is, you know, transformative. And so I am very excited about that.
All right. Well, I'm excited to have had you here on Fox 11 News In Depth. Dr. Suzie Bash, thanks so much.